VA disabled vets that are 50% or more can come into our system. No cost, no nothing. If our system has put someplace 140 miles away from the main hospital in some major town that's not big enough to have a VA facility, all we're doing is working swing shift. The guy comes right in, he goes there instead of driving 140 miles. Free to him because his disability is greater than 50%. At the same time, if that guy's working and he has to take off work and go all the way and drive 140 miles, well, who in the heck wants to do that? That's what I've done all my life. It drove me nuts. I've got a wooden leg, and I went to the VA a lot of times. Every time it was a sick call, sick day. Get the heck out of here, get the job done. I missed work, I lost sync, I lost everything. I was the lead engineer. I needed to be there, and they didn't really like it when I had to take off for these days. When we have this system, it doesn't happen that way. I can sit there and work all day, turn around and go to my doctor, see what's going on that evening, go back and go to work the next day. It is so clean and so easy, and our system, again, is 20% of the cost of the current system, as proved. And as long as it's optional forever, that means you're going to have control as individuals. You can either use our system at 20% of the original cost, and we're not giving up quality. In fact of the matter, there's going to be some consistencies that may not be in the system right now. Not all systems have problems, and we don't think we're going to have any at all. One of the things I didn't talk about is our phase 4. Our phase 4, we're going to have so much money flowing into the system that we can afford to do something special for the United States and our kids. Right now, if you think about it, kids like, say, working at Walmart or working at Burger King or one of the other fast food places or going still into college or something like that, they have children. And when something happens, they can't afford to take care of them. So they end up in emergency or they go into some of the free clinics. Now, when I was a child, I had a single mother, and she worked, but we went to free clinics. In there, my mother had a nightmare about one of the doctors accidentally sticking me in the eye with a needle when they were doing something, I don't know what. And another time when I broke an arm fighting, I went to the free clinic, and they glued my arm back, and as you can see, so the consistency back in when I was a child was a concern. I don't want that for American kids. We can afford to take care of these kids. We can take the pressure off of the young people in our lives. We can set up a system where there's no catastrophic meltdowns where you can completely destroy a family over some kind of a medical crisis. We're taking it out of the system and we're putting it like it needs to happen. $1 billion in 1 year is like $2.7 million a day. So please, the people that listen to this, we don't want a pilot program. We don't want you just to put a few doctors into one state and find out if it works. We're talking about too much money here. The country's going down. Baby boomers are coming. 2011 is the first time the baby boomers walk in and get Medicare. All of a sudden after that, it gets overwhelming. The current system's not going to be affected. Doctors and everybody is going to do what they're going to do. We need them. We need them to keep our system going and the quality high. Because if the quality goes low, they go back to the other system. We as taxpayers end up paying 80% more than what we needed, what we're paying under this system. It's fantastic. Another thing I didn't tell you about is the pharmacy system. Right now we have a fantastic system of taking care of medications and so on. The VA system is just great. They've actually come out and said, hey, you can't get us the right stuff, we're going outside of the country. And they bought things in other countries and brought it back. Right now, the pill pushers of the United States are charging us, in a lot of cases, more money for medicines than they charge other countries. How can that be when they're in the United States right now? There is a problem with the system. As long as our system is big and large and we're united, then we can get some kind of control. Okay, we can't do it unless we're synchronized. Okay, we'll synchronize the country into one beautiful system. Medicare, Medicaid, TRICARE, CHAMP VA, and the whole system all into one. For us to do this, for this system to work, we need to talk about the VA upper management. These are the guys that are not in the VA hospital. They are outside. They are the people that make decisions and make this system work. And it's fantastic. A lot of people are going to tell you nightmares about the VA, but I can promise you, and I'm one of them that will tell you fantastic stories about what the VA has done for me. Okay? So you don't go with the hype that the VA system had. It was really, really difficult in the 1970s going to, and I had to go to them all the time with a wooden leg. But now it's beautiful. People are friendly. Everything's getting along. I had a bypass operation. I've done everything. I've never had a single problem. These guys take care of everything. No questions asked. They got emergency rooms. We got same-day care. We have all kinds of things that'll work. But upper management is going to have to, and the VA system is going to have to eventually come up, depending on what phase we are at, and start picking up more and more responsibilities for hiring, testing, training, placing our clinician team throughout America. And this includes renting space in hospitals that the VA don't own. But again, our people can work swing shifts. It would be fantastic if only the synchronized national healthcare people work swing shift and never on days. That would be a really great goal for me. Okay? But if you go back to days on some of these, it's okay. Now, the VA might say, my gosh, we can't pick on this. If we don't have the manpower. We don't have this. We don't have that to handle everything that we're going to need to handle. Well, guess what? You move in with us, you merge in with us, you start an organization in parallel with some of your other hierarchy and cover things like just the Medicare branch or something like that, then I'm sure Medicare and the VA can come up and split 50-50. And if that happens, the VA will have more money to even put more and more into the system. The Medicare system will have more and more money available to put into their system. The system grows. The system gets better and better and better. But at the same time, the VA will actually have to come in and set up another branch that's dedicated to the scheduling and phone system, because that's going to be critical. It doesn't exist now. We need it. But I'm asking you, please, don't hire a company to come in and create a scheduling database. Why? Because companies are designed so that when you give them a task, they're going to have as many people they can, as the best people they can. They're going to have subcontractors they have to deal with, so they need, to interface with them, so they're going to have to charge, they're going to have to go on the exchange, they're going to have enough profit to sit there and keep people happy, and every one of those is considered fraud to American people. Not to the companies, not to the government. These people have a right to sit there and do what they're doing to make sure they're going to do a good job for us. But the cost is overwhelming. We're saying, please, when it comes to the scheduling and phone database, either do it yourself, using the GS system, or buy something off the shelf, or whatever you have to do. But understand, if you hire a company to do this, every single little change that you want to make is going to cost a fortune. Not because they're trying to do anything bad. It's going to cost us a fortune because they had to keep their people on even though they didn't need them. Just like under the war machines that we have going on. We need satellites, we need this, we need that. These people are experts and so on. We don't need them this year, might need them next year. And so there's an extreme amount of cost in keeping a company alive and well and ready to jump in and handle our responsibilities. Buy off the shelf, create the system yourself, do whatever, but we need the scheduling and communications database created in phase 1, needed for phase 2, really solid. Please start in phase 1 to create this thing. Okay, now with respect to the upper management, we're going to need a third branch. Third branch is because we have a national database. How can you have a national database if everybody doesn't have access? So now they have a system with security checks and everything so that right now there's no HEPA issues. But what happens when we put these in all of the emergency rooms in the United States. How do they take care of that? Who's responsible for that? So we're asking for a branch of the VA to have a section just dedicated to getting access to the National Healthcare Database. This is the third branch that we're asking for. And by the way, when we get this national database set up, look at all the statistical data that people are going out for and trying to get. They're doing everything that they can to get the data. They're putting a lot of people to work, and that's good. But at the same time, under our system, all you have to do is come up, have the right program, boom, you get all the statistical data you want. You want to find out if what's going on this kind of sickness or that, or what kind of disease, or what has the water done to these kind of people and so on. It's all there. Now, I want to make sure that you understand that we need the insurance companies. We need the insurance companies to keep track or keep pressure on the upper management in our VA system. If we're not doing the job, if something happens, then these insurance companies can come out and do the job better. They're going to compete with us. They're going to do better than they are doing now. And at the same time, the insurance companies can handle procedures, new pills, things like that much faster than we can. We're a big organization. We're going to be twice or multiple times bigger than the VA is right now, probably. When that happened, we are slow movers, okay? When something new comes along, it's going to take a long time to trickle down through the system and be able to do things. Insurance companies are that way. They're going to be state of the art. They're going to be the point people for us, okay? They're going to have it, and we're going to try to get it in our system as fast as possible. I'm just giving you a heads up that it may not be as fast as you want, but that's the nature of the beast. And insurance companies, we do need you, we want you, and one of the things you can do, insurance companies, we may need to get you to put in all of the information, all the records, everything into our National Healthcare Database for all your people. Your doctors will use our National Health Database under the current system, and everything will be fine, and we'll just charge you so much money to use it. Everything's going to be cool. Have a good day.